When gearing up for a sinus operation, one of the most valuable pieces of information comes from a non-contrast sinus CT scan. Training programs universally underscore the significance of adopting a systematic approach to reviewing such scans. Noteworthy systems like the checklist pioneered by Dr. Gudis and the closed system introduced by Dr. O'Brien have been previously published. In this video, we delve into the ABCD method. Let's break down this ABCD method. A stands for the nasal airway, which involves assessment of the septum and inferior and middle turbinates. B stands for boundaries of the sinonasal cavity, assessing the dental roots for periapical lucencies, scrutinizing the integrity of the orbit and skull base, paying special attention to the opticocarotid recess, and inspecting the anterior ethmoid arteries to determine if they are pedicled and at risk of injury. Moving on to C and D, which stands for characteristics of disease. It is important to determine if the disease is diffuse or localized. This information can help accurately characterize the subtype of disease. Additionally, it is important to recognize the presence of variant ethmoid cells, such as anode cells, which can increase surgical complexity and increase surgical risk. Let's apply the ABCD method to a case. This is a patient with diffuse pansinusitis. Starting with the nasal airway, we see the septum is deviated to the left side. The turbinates appear hypertrophied. The middle turbinates look normal. There are no concha bullosus present. Moving on to boundaries, looking at the dental roots, we see there are no periapical lucencies. For the dental roots, the sagittal CT series is very helpful at looking at the dental roots. The lamina appears to be intact bilaterally. The anterior ethmoid arteries are mildly pedicled within the ethmoid cavity. The lateral lamella is moderate. It would be a Keros 2. Scrolling back to the opticocarotid recess highlighted here, we see that the bone overlying the carotid artery is intact, as is the bone overlying the optic nerve. Moving on to characteristics of disease. This patient has diffuse pansinusitis or variant ethmoid cells. We see that there's a right-sided anode cell. Moving to the posterior ethmoid, we see continuation of that anode cell on the right, and there are two tiers of posterior ethmoid cells on the left. Scrolling anteriorly to the frontal recess, we see bulla and two suprabulla cells bilaterally. There is an auger and a supraauger cell bilaterally. Again, the sagittal series is very helpful for assessing the frontal recess anatomy. The uncinate attaches laterally to the orbit, which means the drainage pathway is a medial one. After completing the CT review process, it's important to mentally organize the pertinent findings before performing the operation. I've summarized those findings here. If you'd like to explore further, you can find a link to the surgical footage of this patient's sinus operation in the description below. To summarize, the ABCD method evaluates the nasal airway, the boundaries of the sinonasal cavity, and characteristics of disease. There are many good options for systematically reviewing a CT scan. It's important to just choose one that's comprehensive and perform it consistently. The coronal series is the most helpful. However, the sagittal series can be helpful for assessing the dental roots, looking for the presence of anode cells, and assessing the frontal recess anatomy.